following my vlog over the years, then you know I've been uninsured since I graduated from college in 2008. First because I was waiting to get that full-time job with benefits. But once I realized freelancing was going to be my full-time job, then because I couldn't afford health insurance. So that's meant no preventive checkups, going to Planned Parenthood for my birth control needs, and a general don't get hit by any cars rule. I'm happy to announce that as of February 1st, 2014, I am now covered, thanks to the Affordable Care Act, ACA ObamaCare.
I'm familiar with it and I've heard of it, but I just forgot.
I think the ObamaCare is where he tries to have everybody have health insurance, right?
It is a real challenge because it's a complicated law, but I guess the simplest way to explain it is that the Affordable Care Act, aka ObamaCare, is really a way to provide health insurance to people who didn't have insurance, whether or not they were uninsured because they couldn't afford it, or they were tried to get insurance, but the insurance companies wouldn't provide them insurance. So most of the things that the Affordable Care Act does is try to find a way and create a pathway for people to get insurance, whether that's through Medicaid or through private insurance plans. And it also kind of reforms some of the discriminatory practices we used to see in the health insurance marketplace, things like charging women more for health insurance or excluding them for pre-existing conditions like pregnancy or domestic violence, things like that. And then the last thing it does is try to make the benefits more comprehensive and cover things that everyone needs, like maternity care and prescription drugs.
One prescription I've paid out of pocket for a lot over the years is my birth control method of choice. But yes, it is now law that plans must cover the full range of FDA-approved contraceptives without charging you a copay. But after this provision made her birth control free for 7 months, Chelsea was charged $85.
I found out that they had added the generic brand of Loestrin to the drug formulary, and because of that, if I wanted to get the brand name, I would have to pay that much money, but for the generic brand, I could get it for free.
Sounds unfair, but unfortunately, insurance plans can charge you a copay for name brands if there's a generic version available. So if you're still paying a copay for your birth control, head over to the National Women's Law Center's toolkit to see why and what you can do about it. Well, the deadline for signing up for the Affordable Care Act is fast approaching. And for most of us, not signing up means paying 1% of your income or $95, whichever is higher. But why not just sign up? If you feel like you can't afford it, that probably means there's a subsidy with your name on it. And for me, choosing a plan on the healthcare exchange was similar to when I was looking for a camera. I started by thinking about everything I wanted it to do, and then I started eliminating plans based on what I could afford. So go check it out. You have nothing to lose.